My boys and I were jumping, and we were trying to jump high, and I can't jump as high as they can anymore. It just doesn't work. But there are ways to significantly reduce degeneration. Tissue stress and imbalance. When we look at our devices like this all day long, our shoulders are rounded. It puts tremendous stress on our trapezius. That's why we get all these trigger points. It straightens the cervical spine, and you lose the curvature of your spine. It starts loading the discs and can accelerate degeneration. And one of the challenges for the youth today is that they're having accelerated rates of cervical disc degeneration and arthritis formation in the joints of their neck because of the positioning from these devices. We can have chronic inflammation. And what is one of the primary sources of inflammation in our lives?
Food.
The food that we eat, right? What are the inflammatory foods? Dairy, flour, white, yeah, that's right. Flours or processed grains. Sugar, very inflammatory. Meat is very inflammatory. The oils, very inflammatory. Vegetable oil on the omega-6 to omega-3 balance. Ideally, a plant-based diet typically is 2-to-1 or 3-to-1 on the omega-6 to omega-3, which mitigates most inflammation. Vegetable oils are 69 omega-6s, which are inflammatory, to 1 omega-3. And those vegetable oils are ubiquitous in processed food today, restaurant food. Poor blood supply, it's a process called angiogenesis, where we grow new blood vessels. And it's a very important process in healing. If I were to twist my ankle and tear the deltoid ligament in my ankle, because I'm healthy, my body would start the angiogenesis process. And so it turns on the process, and it starts to grow new blood vessels to the damaged ligament so that I have enough blood supply and nutrition to rebuild the ligaments. At the completion of rebuilding, there are factors that are turned on that cause the blood vessels to die back, and I have a normal, healthy ligament. When we have an unhealthy lifestyle, especially the Western diet, it disrupts angiogenesis. And so we do not have the ability to grow blood vessels into damaged tissue. And we actually begin growing blood vessels into unhealthy tissues like fat and cancer cells. And the Angiogenesis Foundation did a large study looking at foods that optimize angiogenesis. And at the conclusion of the research, we could have all told them that it's a plant-based diet. It's spices and herbs and greens and berries that all optimize angiogenesis. And so by eating a healthy diet, your body is able to grow blood vessels into damaged tissue to assist in healing and cut off the blood vessels that would grow into unhealthy tissue. We can have pain from nerves, like diabetic peripheral neuropathy. Do you all know what that is? So some people living with diabetes have small changes and damage to the little blood vessels that supply the nerves in their feet and hands. So those little fine, delicate nerves don't receive adequate blood supply, and they begin to undergo damage to the covering of the nerve. This sets off an inflammatory process that creates terrible hypersensitivity and pain. And some people can't even sleep with a sheet over their feet because it's so much pain. But the good news is the studies show that in as little as 16 days, it can be reversed with a plant-based diet.
Wow.
So they can live with this for years, but by shifting to a whole food plant-based diet, and like they talked about earlier, I always tell my patients, if you have a disease, you have to fight with every bite. So it really makes a difference, the quality and the nutrient density of your diet. But those people that make that shift, in as little as 16 days, their pain can go away. And this has been reproduced in studies all over the world, with the most recent one in Iran just this year. And we can have injuries to the bone. So this is a little diagram that I had an artist put together for me. It just shows us that so many changes that we undergo in our lives are the result of accumulated injury. It's the way that we use 100 bites. It's the way that we walk. It's the sometimes imbalances that we may have because of an old injury. And so it's, stress and genetics, toxic exposures, posture issues, diet inactivity, all crank the scales, and we develop injury day by day. And early on, our body was actually designed to be healthy. Our body's natural state is health. And so we have to sometimes earn disease by making decades of unhealthy choices sometimes those choices are influenced by the culture that surrounds us, and we don't realize that we're making choices or being influenced to make those unhealthy choices. So we're making choices, we feel good, 25, you're invincible. I work with Olympic athletes, and they think that Snickers bars are protein bars. But they are specimens, and they eat it and they feel no difference. But inside of them, we know that something is changing. There's inflammatory markers that are going up shortly after eating that, but they have so much redundancy, such amazing physiology, they can get away with that. And so we go through our 20s, we go through our 30s, we go through our 40s, and then we experience a crisis, a diagnosis, an injury, a degenerative knee, and we say, what happened? In reality, it was this accumulated injury over time that led us to a tipping point. But the good news is that we can go back down that road by making aggressive choices, and the more, the rate of improvement is dependent upon the intensity and the density of our diet and our lifestyle choices. So here's just an example of degenerative osteoarthritis in the knee. We're born with this beautiful hyaline cartilage in our knee, and over time, because of wear and tear, because of excess weight that we might carry, because of inflammatory markers in our diet, and one of those is when we eat meat, it eventually shifts our microbiome to start producing inflammatory mediators like TMAO. How many of you have heard of TMAO? So it's a molecule that's actually produced by bacterial populations in our gut. And as those bacterial populations begin to overgrow because of the exposure to our diet, we start pumping out TMAO into our bloodstream. And one of the places that it actually attacks is the cartilage in our joints. And so in order for us to resolve some of these issues, we have to get to the roots, right? So how do you get rid of weeds? You know, my children sometimes just pull the top off the weeds, and the next week they're like, Dad, I just weeded last week. Like, well, obviously you didn't get the roots. But in order to resolve some of these conditions, we have to go to the root of the problem. If the root of the problem is a diet that's causing inflammation and the production of TMAO, then we need to shift our diet and make a change. If the root of the problem is sometimes 15% of the population will have a leg that's short, a leg length discrepancy, then we need to put a lift in the shoe to bring balance back to the body. If the root of the problem is a postural imbalance, then we need to strengthen the postural muscles. So it's all about finding the root causes and treating the root causes. So something that's really important to remember is that everything is connected in life. And again, our Western culture, our Western society has really worked to disconnect us. And in so disconnecting us, it's easier to manipulate systems, but we are all connected. And when we're talking about preventing and reversing pain, the entire body is connected from the big toe to the top of the head. Despite what my orthopedic partners would tell you that, you know, I'm a foot and ankle guy, I'm the wrist guy, I'm the elbow guy, and so they would go in and say, well, I've got elbow pain and wrist pain. Well, I'm sorry, I don't see wrists. You'll have to go to the wrist person. Well, it seems like they're connected, doesn't it? So we disconnected everything, but everything is connected, and it's all connected by this tissue in our body called fascia. Fascia connects from the joints through the muscles to the tendons and ligaments, and it transfers energy and information. And so if you have an imbalance, a tight foot, the tightness in the foot finds its way up through your knee, up through your hip, to the SI joint, and up through the back, and all the way to the back of the skull. And so it's possible that headaches are caused by a foot problem. When have you heard your doctor tell you that? Never. But it's absolutely true. And by bringing balance back to the body and stretching the tight muscles and strengthening the weak muscles, all of that tension that was finding its way to the back of the skull causing a headache can finally be alleviated, and the pain can go away. And we'll talk some more about posture, nutrient-rich food, strength exercise, regenerative treatments, and stress management. So this is an example of how the body is connected through these fascial planes. And you can see that the way the stress is transferred up through the knee, through the back and the SI joint, all the way up to the base of the skull and wrapping around the ribs. But so often today, if you go to see the doctor with pain, they want to first give you medications, and second, they may want to inject you. And what do they inject? Cortisone. What is cortisone? Steroids. And what does it do? Kills tissue. That's right. Actually, they found that if you get repeated injections in your knee, it accelerates the time to a total knee replacement. Because it reduces inflammation, but it damages the chondrocytes, the cells that build cartilage. And it's only a temporary fix because they didn't pull the weed. They didn't figure out why you have knee problems in the first place. They didn't ask the question as to the causation of the knee pain. They simply injected it, sent you home with some NSAIDs, knowing that you would be back in 6 to 8 weeks, and also knowing that you'll end up with a scope and a total knee replacement down the road. So, same patient, 80 years old. Knee on the left is how old? 80. And knee on the right is? 80. So, yeah, it looks like that, doesn't it? But we can see this is the inside of the knee right here. And we can see that the cartilage has broken down and they have bone on bone. It can be very painful. This knee, which is the same age, still has a nice amount of cartilage. So often the paradigm or the narrative that is in medicine is that we develop arthritis because we get old, right? Don't ever say that about yourself, right? Your words have power. You're not old. You're getting wiser. You're getting stronger. You're getting more vibrant, but you're not getting older. We don't want to speak that over ourselves. So, but this knee is the same age and the cartilage is the same age, but this cartilage is still healthy. So we know that it's not the process of aging that caused the degeneration of this knee, so it had to be something else. And what this patient shared with me is that he had injured his ankle as a young man, and he's a farmer, so he never did anything about it, and said that his ankle hurt every single day. And so to compensate for the ankle pain, he started shifting on the inside of his knee to take the weight off of the outside of his ankle, and he continued to work. But little by little, step by step, every single day, 2,000, 3,000 steps a day, the cartilage broke down and you ended up with bone-on-bone problem. So it just highlights the fact that if your body is telling you have pain, ask why. And then seek out the answer, and the solution may be much simpler than you think. So how many of you ever had to replace your tires in your car because of a misalignment? So, the car is not in alignment, and, the tread is the same age here as it is here, but because of the misalignment, the tread wore down more quickly on this tire. Well, we have misalignments all the time today. We have misalignments because we spend most of our lives sitting. Most of the working jobs today are sitting jobs. So we get up, we sit and have breakfast, we sit in our car to go to work, we sit in a cubby at the computer, we go home, we sit and we have breakfast, and then most of the population sits and watches TV at night or is on a tablet, and then they go to bed. So most of our lives are sitting, and chairs weren't designed to improve your posture. When we sit on a chair, most of us sit all the way back, and our back flattens and we tend to roll forward. The way to sit on a chair that positions your posture, if you're all scoot forward just a little bit, and it forces you to sit tall. You feel that? And you may actually feel your muscles fatigue because you're not used to sitting tall. It's almost like sitting on a stool. It's much better for your posture. So when you're sitting for a long time, you can just move forward. Or you can get a ball and sit on a ball, or you get a standing desk, but the more often that you can move, the better. In fact, new studies have also come out saying sitting is the new smoking, right? You've heard that. So it's better when you can move and to stretch. And then the last comment is on, you can see what happens to the cervical spine and the muscles in the neck when we're looking at our devices. And so simply shifting your device up to eye level and looking here restores the natural curvature in the cervical spine, takes the pressure off of the cervical discs, and eliminates the tension in those trapezius muscles. Anybody ever get trigger points and tight traps? Yes. And it's because so much of our lives are like this. So the more that we can shift up and back, the better. And a very simple exercise that you can do at home, either with or without a broom handle, is to just simply hold your hands up and squat down a little bit, and you will feel all of those postural muscles engage in the back. And it's a nice thing to do in the morning, or when you're, even if you decide to watch a movie, you can sit and watch the first part of the movie and exercise. This is a book that I have used for 15 years. And Pete Agoscu is the author of this book, EGOSCUE, and they have realignment exercises by body part. And I've had such amazing success asking people to simply do the exercises at home, foregoing surgeries, injections. They treated themselves, they realigned their bodies, and they overcame their injuries and didn't need any further medical care. So it's a terrific resource. It's also important to find other exercises, and you can do so many of these at home: Pilates and postural yoga, regular stretching. And you know, I stretch all the time. If I'm on the phone, I'm stretching my calves, I'm stretching here, I'm leaning against the table. I try to find every opportunity that I can to stretch. I also like to, I think of it in my mind as redeeming the time exercises. So if I'm on the phone, I'll sit and do a wall sit. If I'm on an airplane, I'll do isometric exercises. If I'm driving at a stoplight, I'll pull up on the steering wheel, I'll do crunches. And so I'm always looking for ways to just move more and exercise more. And by redeeming those little 30-second or 1-minute bites out of your day, it's incredible how much activity you can add to your life and how much strength you can gain over that short period of time. And then if you, there are physical therapists that are trained in the kinetic chain. That simply means the transfer of energy from the foot to the top of the head. And so finding a physical therapist that can help work through your kinetic chain can also be a wonderful way to solve some of the challenges that you might be facing. So, who can tell me what a polyphenol is? Compound, right. And what do we often associate? So it's plants, right, it's the colors in the plants. The purple in the grapes, it's the black in the blackberries, the red in the raspberries, the greens in the kale. But polyphenols, just phytochemicals, do amazing things in the body. And when we look at so many of these things in medicine, we want to, medicine always wants to reduce things down to like single functions. So we think about polyphenols only doing one thing. But the phytochemicals, like those beautiful apples over there, when you bite into the apple and it has quercetin in the skin, the polyphenols do amazing things. The colors, they turn off this critical inflammatory switch in the body called NF-kappa beta. And that is a critical switch because it impacts 400 different genes in inflammation. So once that switch gets turned on, it turns on 400 genes in the inflammatory cascade that have been associated with all of these diseases. So when you're eating salad at lunch, the polyphenols are going down into your body and they're turning off NF-kappa beta. It's amazing. It's happening in 2 to 3 hours. This is a great thing to share at a dinner party. Gets the conversation going. Did you know you're turning off your NF-kappa beta switch? And then the polyphenols find their way down into your microbiome. And so it's not just fiber that feeds the microbiome, but it's also polyphenols that shift the bacteria, and they assist in the production of butyrate, which is a short-chain fatty acid. Butyrate also turns off NF-kappa beta. So NF-kappa beta is getting turned off, and there's other sources too, from multiple ways through a plant-based diet. And it's just turning down the whole inflammatory dial. That rheostat is getting readjusted with every meal and every bite. And the quality of your diet really does matter. This was a study that looked at a high-quality plant-based diet versus a low-quality, and it's to highlight the importance of polyphenols and phytochemicals in reducing inflammation. So the low-quality diet, fruits, apples, pears, bananas, melons, vegetables were like eggplant, leek potatoes, zucchini, French beans. Excuse me. But all of those are okay to eat. But when they compared it to a diet that contained more dark colors, red berries, grapefruit, plums, spinach, beet, Swiss chard, peppers, Brussels sprouts, they found that the high antioxidant diet much more effectively reduced inflammation measured by CRP than a low antioxidant diet. So if we're talking about reducing inflammation, overcoming pain, assisting the body in healing, it's really important to shift and eat much more of the darker colored fruits and vegetables. They really do make a difference. And so if you're facing a challenge, an inflammatory challenge, you're trying to overcome a disease, the darker the fruits and vegetables, the better. And I just learned yesterday, I didn't know this, but they have purple basil. Did you know that? Some of you may know that. Yeah, it's delicious. And so purple basil can be mixed with green basil or lemon basil, and you can have this amazing mix that incorporates different phytochemicals and has a more profound effect on the inflammatory levels. When we eat a plant-based diet too, we also are affecting the mitochondria. Does anybody know what mitochondria are in the body? What's a simple way? Like the batteries, the power plants, that's right. But like every power plant, they produce some byproducts, free radicals, reactive oxygen species, and the free radicals are mitigated by the antioxidants in your diet. So when you're eating plants, eating berries, you're having a nice berry salad, all of the antioxidants in the berries help to clean up the waste products of your mitochondria. They're the powerhouse of the cell, and on a plant-based diet, they help to maintain this very important antioxidant system called glutathione. And a plant-based diet optimizes not only the efficiency of the mitochondria, but you actually begin producing more mitochondria. Isn't that incredible?
Yeah.
This is why so many of the high-end ultra-endurance athletes are shifting toward a plant-based diet, because they find they're so much more efficient. It's not just that they're lowering the inflammatory levels, but they're actually growing new mitochondria, which gives them greater energy efficiency. So as we're eating food, it's important to remember food is never neutral. And our culture has taught us that, food is calories. If we eat these calories, we can burn these calories off. We just have to exercise a little bit more. But what's the problem with that concept? It's so simplistic. People underestimate what? The number of calories they burn, and they overestimate the number of calories they consume, right? Grossly overestimate the amount of calories that they're burning. They grossly underestimate the calories they burn, so they never win the calorie war. How many calories will you eat in your lifetime? 58 million, give or take a couple million. So are you going to win the balance of the calories over a lifetime? You have to be a pretty good mathematician, much better than I am, to balance 58 million calories. But food is never neutral. Hippocrates said that healing is not only a matter of time, but also opportunity. So in the healing cascade, we have to give our body the opportunity to heal, and it's by choosing the right foods that we can be on the positive side of the healing cascade. So a few foods that are beneficial in healing are the root herbs like ginger and garlic and turmeric. And so creating opportunities to expose yourself to turmeric can be really beneficial. There have been more than 1,000 studies on turmeric that document anti-cancer properties. Thousands of studies show effectiveness in more than 70 different diseases. And in some cases, it's actually more effective than pharmaceutical drugs. But what should you include with your turmeric to improve its
Black
pepper, right? The pepperine increases the efficiency by almost 900%. So just a couple twists of your black pepper with your turmeric, and it enhances the anti-inflammatory effects of the turmeric in your diet. These are just a couple of highlights of how plants heal. Things like chia seed, flaxseed, and hemp seeds have omega-3 fatty acids, and the omega-3 fatty acids not only reduce inflammation, but they assist in bone formation and they minimize bone breakdown. When you're eating that steamed broccoli at lunch, the ITCs stimulate your stem cells to heal your cartilage and your bone. Isn't that amazing? Grapes and green tea stimulate stem cells to maintain cartilage and bone. When you have a cup of green tea in the morning, the catechins enhance bone formation, and they enhance your stem cells to grow. Phytochemicals and polyphenols preserve your bone health, as we'll see in a minute. Phytochemicals prevent menopausal bone loss as we get wiser. And cartilage repair is improved by all of the small micronutrients that we have in food. So as you're eating a meal, it's having this profound multiplied effect throughout your entire body. So as we talk about bone, and building stronger bones, it's important to remember that your bones are a living tissue. So your bone is alive, your bone is constantly adapting, just like your muscles. So if you were to lift weights and progressively lift heavier and heavier weights, your muscles grow because they're alive. And the same thing is true of your bones. The more that you stress your bones, the more that they activate and rebuild to handle that stress. So bone is a living tissue. If someone is in the hospital and in 36 weeks of bed rest, they'll lose almost 40% of their total bone density. So inactivity causes a depletion of calcium and bone strength. And when we think about the lifestyle of most Americans and now the westernized world, we have a lifestyle of inactivity, and we're not stressing our skeletal systems. We're actually looking for ways to minimize the stress. We put wheels on our suitcases, which I'm very grateful for. In the old days, stressing your skeletal system. And we'll talk briefly about calcium metabolism, because so much of the information today is take more calcium. But it's not really true, as we'll talk about. It's not how much you take in, but what does your body do with it and how much you're losing. That's really important. So osteoporosis is really atrophy of the bones. That's the way to think about it. Your bones are atrophying. And so you have normal, strong bone, and then we get this atrophied bone over time through disuse. And what's interesting, if you get a study looking at bone density, they do wrist, spine, hip, and sometimes different locations. So some people will have, osteoporosis or osteopenia of the hip, but their spine is fine. So it starts to tell you, well, wait a minute, it's not really a systemic problem then. It's more of a localized issue and a disrupted physiologic mechanism. So calcium can come in many sources, and plants are obviously the best source. And why is it better to get your calcium from food? What do you think? It's better absorbed.
Does it mess with your other organs like kidney or something?
Yeah, because calcium comes packaged with fiber, phytochemicals, micronutrients, vitamins, all of those things that are important in allowing that calcium to be assimilated and absorbed in the right way. Supplementation can sometimes have detrimental effects, as some of the studies are showing now that if you over-supplement with calcium, it can increase your risk of cardiovascular disease and other problems. So if we think about calcium for a minute, we take calcium in our mouth, it goes down to our stomach, and the first step then is absorption in our stomach. And so we need several things to have the calcium absorbed. Vitamin D is obviously important. And so during the winter, it's important to have Dr. Weiss check your vitamin D levels. And if you're low, you need to take some vitamin D especially. How do we naturally get vitamin D?
Sun.
From the sun, that's right. So the more that you can be outside, the better, even in the winter time. Some other things decrease the absorption of calcium in our stomach that are common today, prescribed by my colleagues. And what would some of those be? I have burning in my stomach, and they would give me antacids, or the purple pill, right? Proton pump inhibitors. All of those decrease the absorption of calcium. NSAIDs decrease the absorption of calcium. So medications that are common, there are other beta blockers, all these medications can decrease the calcium. So you can take calcium in by supplement or food and not get it absorbed into your system. Then it goes out into our bloodstream, finds its way to the bone, and it has to get assimilated into the bone. And at that point, we need minerals. These small micronutrients that are found in this amazing regenerative soil that Dr. Weiss is using that find their way into the plants, molybdenum, manganese, silica, all of these micronutrients in the plants assist in assimilating calcium as it makes its way into the bone. And then we have this really important one with excretion. And they've done studies and found that when we have an acidic diet, our body balances the acids that we're eating with a buffer, and the buffer is calcium from our bones. So as we're eating too much meat or acidic foods, the body says, oh, our blood is more acidic, so we need to buffer that with a base. So let's pull calcium out of the bones, tag it to the acid, and we'll excrete it. And so people eating high meat diets have higher levels of calcium excretion in their urine. And when they studied the ancient Eskimos, they had very early and high levels of osteoporosis and vertebral body fractures. because of the high consumption of animal products and the acidic nature of their diet. So you can get calcium from lots of different sources. 2 cups of collard greens, 600 milligrams. Turnip greens, 500 milligrams. Couple cups of kale, 350. Broccoli, 190. Soybeans, half a cup, 250. Okra, 123. Fruits and vegetables, sesame seeds, nuts and seeds filled with calcium. And on a plant-based diet, you'll get more than enough calcium to meet the body's needs if you're eating a wide variety of fruits and vegetables. And the calcium that comes from plants is much more readily absorbed and assimilated than the calcium that would come from milk. So here's what happens when we're eating these beautiful phytochemicals. It goes down and it turns on the bone building cells, and it turns off the cells that chew up bone. And so in that way, the phytochemicals are enhancing the restoration and the strength of bones. So here is normal bone, and this is the bone that has resulted from excess animal products, soft drinks, the phosphoric acid in soft drinks strips calcium right out of the bones, vitamin D deficiency, supplements that have excess vitamin A. So if you're taking a supplement, make sure that it does not have excessive vitamin A levels, because that also strips calcium out of the bones. Caffeine and tobacco, high sodium content, sugar, and inactivity all take a toll on the bones. And so we can begin to see why we have this epidemic of osteoporosis today, because this is the Western lifestyle. So one of the things that's very beneficial is weight-bearing exercise, and it can be very simple. It can be just not even doing push-ups, but holding positions to strengthen your bones. It can be walking or even adding a little bit of weight to your back with a backpack or a weighted vest. My grandfather used to travel with dumbbells, and he would, watch TV, and he was always using dumbbells. And so there are lots of ways to just add stress to your skeletal system. The astronauts, and we use this in my practice, utilize those power plates, the vibrational plates, where you stand on it and the plate vibrates at a high frequency, 30 to 50 hertz, and it's rising and falling just a small number of millimeters, but it's stressing your skeletal system, and it's an excellent way to rebuild bone. So just some suggestions then for improving the strength of your bones: weight-bearing exercise, like we talked about, nutrient-rich diet, avoid supplements, check your vitamin D levels, and limit the junk. And stress is also an important component here too. Stress creates an acidic environment in the body, and you'll lose calcium from your bones. Cortisol, which is normally produced under stressful environments in your body, has the same effect as taking prednisone. So if you're living a stressful life and your body is cranking out cortisol in response to stress, it's like taking a daily dose of prednisone, and it will result in osteopenia and eventually osteoporosis. So what if you do all these things and you're still in pain? What do? I'm going to give you just a few suggestions from my experience. So there's an amazing field called regenerative medicine, where we can utilize natural treatments directed at the area of the injury to stimulate the body's normal healing mechanisms to begin restoring and repairing that tissue. So this is an example. This is a patient that had an injury to his patellar tendon, a basketball athlete. So we're looking at the patellar tendon from the side, like right down here. And we can see that there's these kind of dark areas in the tendon. And so you can target some injections into that tendon. And we can see that by 7 months, the tendon has become thick and robust with nice linear pattern of collagen that's been laid down inside of that tendon. And so all of his pain was resolved. He had a nice healthy tendon, and he went back to playing basketball without any discomfort. But it highlights the fact that the source of his pain was a tear and a degenerative section in his tendon that would not have healed did we not intervene with a treatment. So there are several treatments. One of them is called platelet-rich plasma, and that is where we draw off some of your own blood. We're able to centrifuge down and isolate the growth factors, and then under ultrasound treatment, or just through a needle, you can inject the torn tissue, and it starts the whole healing process over. and it initiates this cascade which begins to lay down new tissue inside of that torn area. If it's a small tear, that's very effective. If it's a larger tear, they have a treatment now where they've isolated these exosomes, which are signaling molecules from one cell to another cell. And so these molecules signal the stem cells and the other reparative cells to pay attention to the damaged tissue and to heal that tissue. And as an example, I recently took care of a baseball player from Florida who had almost a complete tear of his rotator cuff. But the surgeons didn't want to operate because he was 19, and the outcomes after surgery returning to baseball are not great when you've had almost a near full thickness rotator cuff tear. So we were able to do exosomes and PRP in his shoulder and then repeat the MRI in 4 months, and the rotator cuff was completely healed. And he's playing baseball this fall. So there are some beautiful options to heal tissue and to mitigate that damage, because over time, if that rotator cuff is not healed, he starts to develop pain, and eventually it will tear through, and then you have to undergo surgery. And surgery is as good at fixing things, but it doesn't repair things permanently, and there's always a risk of a secondary complication from surgery. So anything you can do to treat the tissue and heal it makes a big difference. And this is an example of it. This is the needle under ultrasound, and we're injecting right into the tendon. So you can direct it where it needs to go. This is a slide I put together because I just wanted to highlight this concept when we're talking about regeneration. So this is the regenerative potential of a whole food plant-based diet. This is not based on randomized control trials or meta-analysis. This is based on 16 years of experience in treating people and reading lots of studies. And I really have come to believe in the power of organic food, especially grown regeneratively. There are at least 25%, at the very low end on the studies, more nutrients in organic food than non-organic food. And in many cases, when they measure the polyphenols, the antioxidants, phytochemicals, it is far superior, 40 to 60% more in organic compared to non-organic or conventionally grown food. When they've done studies looking at organic food at Hershey Medical Center, they're looking at purple potatoes, and the purple potatoes are able to create phytochemicals that kill cancer cells when they're grown in organic soil, but they're not present when they're grown in conventional soil. So it gives us an idea that as we're eating organic produce, we may be getting more than we really thought we were getting. And so the value of organic is far superior, I believe, over time than we really realize. So, and I have seen that when people even make a shift to eating more organic food, their health and their quality of health and the rapidity of their improvement increases significantly. So I really believe that the regenerative potential increases with the percentage of our diet that is from organic whole food plant-based diet. And this is not just physical regenerative for you and I, but this is also regeneration of the earth. This is regeneration of water resources, land resources, soil resources, climate change. The more that we shift in this direction toward more and more organic whole food plant-based diet, the greater the regenerative potential at every level of that interconnected food web that we talked about at the beginning. And I want to end with this too. No matter how far you've traveled down one road, you're only one step away from choosing a new direction. And that applies to every single day. If you go down a road, and if Ron Weiss had cheese pizza, it's okay, because the next meal he just chooses a different direction. I really want to encourage you that, give yourself grace in the process. Yeah. When we take on guilt and shame and condemnation, or we're hard on ourselves and we judge ourselves as we're making a lifestyle change, it makes it more difficult. If you can give yourself grace in the process becomes fun, and the process leads to breakthrough and outcome. So this is just some resources for you. This is the Plantrition Project, the not-for-profit that we started to educate healthcare providers. And as Ron was so kind to point out, we have conferences, we have resources, we have free downloadable quick start guides. We started the journal, the International Journal of Disease Reversal and Prevention, and I put a comments period, But that journal is free. We created it to be an open source journal so everybody can access the journal, so there's no barrier to accessing life-changing science. Dr. Kim Williams is our editor-in-chief, and he's doing an amazing job. We just started in April, so our second edition is coming out next week. And you can sign up on the website, ijdrp.org. Those are our conferences. This is a way to find a healthcare practitioner, although you don't need to do that because you've got Dr. Weiss here. And of course, Dr. Michael Greger's website is always a tremendous resource. I just want to thank Dr. Weiss and all of you and the Ethos team for allowing me to be here today.